Hi there. Today we're going to talk about one of the most sensitive and vital aspects of child development communication. Every child develops at their own pace, but in some cases delays in speech or the use of unclear language may signal something more serious, a communication disorder. So, is it normal if your child speaks late, or talks a lot but no one seems to understand them? In this video, you'll learn, what are communication disorders? What types are there? What should we expect at different ages? Which signs are red flags? How are they diagnosed and what kind of support is available? We'll explore answers to many of your questions. So let's get started. Communication disorders involve significant difficulties in expressing oneself verbally or non-verbally, or understanding what others are trying to communicate. They are generally divided into four main categories. So, language disorders can make it tough for children to form sentences that are right for their age, express themselves clearly, or even understand what others are saying. These challenges might show up in expressive language, which is speaking, or in receptive language, which is understanding. Speech disorders, on the other hand, include issues with how sounds are produced, as well as, fluency and vocal tone. Some examples are articulation disorders like saying Y instead of R, stuttering and cluttering, which is when speech is rapid and kind of unclear. Voice disorders, well, these involve abnormalities in the quality of the voice, like sounding hoarse, breathy, maybe overly high-pitched or strained. This is often because of misuse of the vocal cords or sometimes structural issues. Social communication disorder, sometimes called pragmatic language disorder, often looks a lot like some of the challenges seen in autism. These disorders can really impact a child's ability to use both verbal and nonverbal cues in social interactions. Things like making eye contact, starting conversations, or even using facial expressions. So, when should you be concerned? Well, if your child isn't saying any single words by 12 months, can't form two-word phrases by age 2, speaks in a way that's tough to understand, struggles a lot with understanding language, or has poor eye contact, limited play, or weak social engagement, it's definitely time to reach out to a child mental health expert or a speech and language therapist. Let's talk about stuttering for a moment. It's actually one of the most common and often misunderstood speech disorders out there. Stuttering involves speech interruptions like blocks, repeating sounds or syllables, and prolongations. At first it might seem like a simple issue, but honestly it's the result of some pretty complex neurophysiological and motor coordination processes. The brain's speech control systems, including breath, vocal cords, and articulation, can sometimes fall out of sync, and that's what causes these disruptions. There's also, a strong emotional component. Children who stutter often worry about when they'll get stuck, which can lead them to pause, freeze, or even just stay silent. This can trigger feelings like frustration, embarrassment, and sometimes even social isolation. Over time, it may negatively affect their self-confidence and academic success. Research shows that it's not just the speech motor system at play here. Temperament factors like attention span, emotional reactivity, and mood can also influence stuttering. Some children with high energy or difficulty adapting to change may actually be more prone to persistent stuttering. So, what can we do about stuttering? Well, here's what works. Speech therapy guided by specialists that focuses not only on fluency techniques, but also on managing the child's anxiety and emotions. A supportive home environment where the pressure to speak perfectly is reduced and encouraging language is used can really make a difference. Customized therapy plans that match the child's individual personality, emotional needs, and communication style are also important. And of course, early intervention is key, both for speech development and self-esteem. Final thoughts. Early support makes all the difference. Early intervention is absolutely critical in communication disorders. Language development is not just about speaking. It's deeply connected to thinking, learning, emotional expression, and forming relationships. So what kinds of support are available? Support and treatment approaches include several key components. First, speech and language therapy. Sessions with professionals can significantly improve both expressive and receptive language skills. Second, special education programs. In some cases, individualized education plans or IEPs are essential to help the child thrive in school. Third, family involvement. Practicing strategies at home and maintaining a supportive communication environment can accelerate progress. Parents are the child's primary role models. Fourth, technological tools. Picture cards, apps, and assistive communication devices can be very effective in enhancing interaction. Lastly, multidisciplinary collaboration. If the child also has hearing loss, autism, or intellectual disability, coordinated care among specialists is essential. Speaking is a right. Speaking is one of the most powerful ways we express who we are. If a child is struggling to communicate, it's not their failure. It's a signal for us to try harder to understand and support them. Remember, recognizing the signs early, connecting with the right professionals, and creating a loving communication space can completely change a child's future. In this video, we explored communication disorders, their types, and practical ways to support children facing these challenges. If you found this video helpful, don't forget to subscribe, leave a comment, and share it, especially with those who work with or care for children. See you in the next video.